So, welcome back. Welcome to our YouTube channel, GG Classes. Today's topic of discussion is Cushing syndrome. Yeah, this is actually one of the topic we can say it's known to everyone, but still it's unknown to everyone. There are many parts, maybe in NEET PG aspects or fourth year aspects, we have to study it in detail. So, let's make Cushing syndrome easier and let's study it. Okay, Cushing syndrome. Everyone knows about Cushing syndrome, but there is some entity called as pseudo-Cushing's. What is pseudo-Cushing's? It is a triad. So I remember it in a simple way. There is a obese person. Due to the obesity, he has developed depression. In order to overcome depression, he is drinking alcohol. So it is a triad of obesity, depression, alcoholism. Okay. Now let's study about true Cushing's. True Cushing syndrome. Again, I'll divide it into Cushing syndrome, Cushing's disease. Actually, the Cushing's disease is a part of Cushing syndrome. So, Cushing syndrome is an umbrella term which includes all the conditions where cortisol is increased. Actually, the most common cause of Cushing syndrome is iatrogenic, which is followed by Cushing's disease, that is pituitary adenoma. Pituitary adenoma constitutes the Cushing's disease which causes increased cortisol. Let's study about clinical features of Cushing syndrome. We remember the clinical features of Cushing syndrome as glucocorticoids. The same mnemonic can be used in two ways. One, we can use this mnemonic for the glucocorticoids side effects. Second, we will remember this mnemonic for this Cushing syndrome. So let's start with gluco. G stands for glaucoma. Glaucoma, we will remember something called as GTCS. G stands for glaucoma, T stands for topical, C stands for cataract, S stands for systemic. Whenever we give steroids as a topical, it leads to glaucoma. Whenever we give steroids as systemic, it leads to cataract. L refers to limb muscle atrophy because there is a muscle protein breakdown will be happening in a periphery. Then U stands for peptic ulcer. Peptic ulcer occurs because there is increased gastrin, decreased mucus and decreased prostaglandin synthesis. So there is increased acid production and decreased mucus production. So that will lead to formation of ulcer in the stomach. Then C stands for cataract. As we have already studied, cataract is because of the systemic side effect of the steroid. Then O stands for osteoporosis because glucose causes increased resorption and decreased synthesis, so which leads to osteoporosis. C stands for Cushingoid phases. Instead of studying Cushingoid phases, we'll study about the fat redistribution. So you can see the person over here. The fat redistribution actually occurs in three places. One, nape of neck, which is called as buffalo hump. Two, at the belly region, which is called as orange onistic appearance. Three, at the face, which is called as Cushingoid phases. Yeah. C also stands for coagulation defects. There will be hypercoagulability will be present. O stands for osteonecrosis. There will be avascular osteonecrosis will be happening. R stands for renal failure. T stands for TB. There will be ileocecal TB. The person will be predisposed to a ileocecal TB, which is mainly because of glucocorticoid excess, that is drug related. I stands for infections because of immunosuppression. C stands for congestive heart failure. O stands for edema. I for impaired healing. D for diabetes mellitus. S for severe psychiatric illness, and S also stands for striae, which are greater than 1 cm. We have to remember they should be greater than 1 cm. Just now I said about severe psychiatric illness. The person of Cushing syndrome can also present as psychiatric patient. So mainly he will be presenting with symptoms such as depression, etc. Cushing syndrome has another two counterparts: ACTH dependent Cushing syndrome, ACTH independent Cushing syndrome. ACTH dependent Cushing syndrome, there will be increased cortisol in the body secondary to increase in the ACTH. This ACTH increases mainly because of two reasons. One is because of pituitary adenoma, another it may be because of paraneoplastic syndrome which is producing the ACTH. The most common cause being the pituitary adenomas. As this ACTH is synthesized, this ACTH has a precursor which is called as POMC, pre-opio melanocorticotropic hormone. This pre-opio melanocorticotropic hormone is the same precursor which is required for the melanin synthesis. So whenever the person is having a ACTH dependent Cushing syndrome, the person will be also having the hyperpigmentation. Now let's study about ACTH independent Cushing syndrome. Here the cortisol is increased but ACTH will be completely normal. As ACTH is normal, POMC will be normal. So there will be no excess melanin synthesis. So the person will be having no pigmentation. I have just said about two causes for ACTH dependent Cushing syndrome. One being the pituitary adenomas, another being ectopic ACTH disease, which is paraneoplastic syndrome. So now pituitary adenomas. These pituitary adenomas are slow growing. So no dyselectrolytemia, as the body will be buffering the whatever the dyselectrolytemia happening. Ectopic ACTH disease. This is actually a fast growing disease, so the body can't buffer whatever the dyselectrolytemia will be happening. Here the glucocorticoid excess will be acting on the mineralocorticoid receptor, as it is having a aldosterone actions. So it acts on the mineralocorticoid receptor and it will be causing the general those side effects which are caused by the aldosterone: hypokalemia, sodium and water retention, alkalosis. Let us study about the diagnostic protocol of Cushing syndrome. Actually, this is interesting part, so listen carefully. Whenever we suspect a patient with Cushing syndrome, we will do two types of tests. One is called as main tests, another is called as other tests. The other tests include urine cortisol, salivary assay, which is not important, so we will not study about it. Now, main tests. In main test, we will do low dose dexamethasone suppression test, which is done overnight, and we will measure the cortisol levels of that person at morning 8 am. So we'll get three types of results. One, the cortisol level is less than 1.8 microgram per deciliter. Let's say it is 2. Then we say the person is completely normal. If the 8 am cortisol levels are between 2 to 5, we have to do other tests. Just now we have mentioned the other tests. We can do those tests and confirm. If the level is greater than 5, it is called as Cushing syndrome. Once we confirm it as Cushing syndrome, we have to do the ACTH assay. ACTH assay is done in order to localize the tumor. So once we do this ACTH assay, we get two results: ACTH high or ACTH low. If ACTH is high, it may be because of pituitary adenoma or because of the ectopic ACTH secretion, which is paraneoplastic tumor. Then we have to do the high dose dexamethasone suppression test, not low dose, high dose dexamethasone suppression test. Again, we get three results. If the cortisol is decreased, here the cortisol decreased because we have given high dose dexamethasone, which is a steroid. So pituitary feels that there is enough steroid, so it decreases ACTH secretion, thus cortisol secretion also decreases. So this constitutes that it is a pituitary adenoma. Another result is cortisol increased. If the cortisol is increased or it is almost normal, we say it as paraneoplastic syndrome. Then we have to do the resection of the tumor. So we can have another result, which is equivocal result. If we get an equivocal result, then we have to take two blood samples. One blood sample is from the inferior petrosal sinus, because pituitary drains directly into inferior petrosal sinus, and another sample is from the peripheral vein. So then we have to take a ratio of petrosal to peripheral vein. Once we take the ratio, we get two values. Either it is greater than 2 or it is less than 2. If it is greater than 2, we say it as pituitary adenoma. If it is less than 2, we say it as ectopic ACTH syndrome or ectopic ACTH tumor. Similarly, we can give a CRH injection, corticotropic releasing hormone injection, and we can take the same ratio. If the ratio is greater than 3 or if the ratio is less than 3. If the ratio is greater than 3, we say it as pituitary adenoma. If the ratio is less than 3, we will say it as ectopic ACTH tumor. Now let's study about what if ACTH is low. If ACTH is low, we have to do NCCT. Once we do NCCT, we can get two types of lesions: unilateral pathology or bilateral pathology. If there is a bilateral pathology, we say it as bilateral adrenal hyperplasia. In this situation, bilateral adrenalectomy has to be done. So some patients after having bilateral adrenalectomy will develop something called as Nelson syndrome. Keep in touch with us. We will discuss Nelson syndrome in tomorrow's video, so keep updated. Now, unilateral pathology. Whenever there is unilateral pathology, we will do 17 keto steroid assay. It may be increased or decreased. If it is increased, it is malignancy. If it is decreased, it is adrenal adenoma. So we have come to the end of the lecture. Let's wind it up with the treatment of Cushing's. It can be surgical approach or it can be pharmacological approach. In surgical approach, we will be doing a transpenoidal resection or resection of the tumor wherever it is in case of paraneoplastic tumors. In transpenoidal resection, actually we will do this for pituitary adenomas. Whenever we do transpenoidal resection, it can work or it can undergo failure. If it undergoes failure, we have to add the patient with pesariotide. Now let's go for pharmacological approach. In pharmacological approach, we will be discussing the drugs at 3 levels. One which act at the pituitary level, one which act at the steroid synthesis inhibition level, one which act at the receptor level. At the pituitary level, we will be having 2 drugs. One is pesariotide and another is cabergoline. At the steroid synthesis inhibition, we will be having 5 drugs. Let's remember it as make cake. M stands for mitoten metyrapone. A stands for aminoglutathione, K stands for ketoconazole, E stands for etomidate, K stands for cyproheptadine, and finally at the receptor level mifepristone. Thank you.